Introduction to psychiatry. Psychiatry, or otherwise called the mental illness. How the mental illness or the mental disorders are coming. If you take a human being is made up of, a man is made up of body, mind and the spirit. And the body, mind and the spirit is having a constant interaction with an environment. So what's happening? Bodily systems, we have a different body systems like respiratory system, inflammatory system, cardiovascular system, respiratory system. Each systems are interrelated with each other. One system is affected, other systems also will be affected. Same way, the mind and body have a great relationship within each other. So what is mind? The mind means it consists of conscious mind, unconscious mind, preconscious mind, subconscious mind, all there. So how these mental disorders are coming for the normal human being? First, you must know development of the brain. When the neural tube is developing, so what's happening? Before the mother knows that she is conceived, within 4 weeks, the neural tube has been developed. By the time, without knowing that, the mother take any of the medications or exposure to the ultraviolet rays or radiations exposure may cause some of the defects. Also, the mental illnesses are transmitted from the some of the genetically it is transmitted from the one generation to the another generation. Some other side effects and drugs and the birth injuries or the birth defects and side effects of this one due to illness of some other this one secondary mental illness also pathological condition, any pathological disease condition may lead to the secondary illness as a mental illness. All has been under classified under the psychiatric disorders, international classification of the diseases. Let us see what is why mind and body have a relationship, right or not? The I told you, as I told you, so these are all the causes for developing of the mental illnesses. If you take a mind, it's a brain is an important part. It has got two hemispheres. It has got forebrain, midbrain, hindbrain, cerebellum is mainly for the balancing of our body. Okay, and the mind is a conscious mind, unconscious mind, preconscious mind is there, and there is a million of the nerves are connected, neurons are there. It has got a gray matter, white matter. There are various lobes, parietal lobe, frontal lobe, and areas of the brain. Broca's area, hearing area, visual area, this is a sensory area of the brain and motor area of the brain. So many nerves are connected as forms the neural tract. So how this again, these nerve systems again will be classified into the central nervous system, peripheral nervous system, right? PNS, CNS. CNS is a central nervous system and PNS is a peripheral nervous system. So it's like a perception, sensation. So these nerves are connected from that one. From and then it is go to the neural path and the sensory area of the brain we are perceiving. So when the human is perceiving that, and then in the hemisphere, if you take in the brain, that hemispheres, each hemisphere have got some function. Right hemispheres and left hemispheres have different function. Hopings, right hemisphere if you take hoping designs and discrimination of shapes, readings, music, understanding, expression, like negative emotions, and then white matters are more in this right hemisphere. It is more gray matter in the left hemispheres, and sensation of the both sides of the face and sound perception, pain perception, and all mostly right hemisphere. Language, skills, movement, positive emotions, high level dopamine are present over here. So this is about the each lobe, this one. So sometimes persons may get some infections or the defect also may cause the mental illnesses. So now next, if you see the nervous system, as I told you, CNS, PNS, SPNS, NPN, MPNS, motor nervous system, sensory motor nervous system, like that. So this is perception. If you touch this one, perception, sensation by the sensory organs. Skin may not be coming here, but also visual, auditory, taste, and the position, interoception. Closing your eye, you can feel where is your nose. That's called the interoception. So this sensation. These are all the normal human being, all this in perception, like a time perception. I can ask you what is your time. You can tell the time perception of the if sometimes if there is a disturbance, these are all normal human being are having. This one only, this brain is having only hemispheres, areas of the brain, or the nerves are connected, or only nervous system. No, it is the another important thing, your behavior. There is a hormone is highly responsible, endocrine system in the brain, playing a vital role in the human being. In that hypothalamus, it's a director and deductor. It is like only 9 gram nail shaped it will be, but it will be affected by your emotions, your environment, your everything will be affected. The mainly hormones are secreted by the secretory hormone and prohibiting hormones. Then this lymphatic system will be sending the information to the uh, like posterior pituitary, anterior pituitary. Posterior pituitary, only two hormones are secreted, oxytocin and vasopressin. But other all thyroid hormone, follicular stimulating hormone, all are secreted by the this hormone. And moreover that in a psychiatric, this one pineal gland or pineal body also there are present. So some of the hormones are very much responsible for maintain our system. It's like a engine oil in our body. You need the food, maybe the food will be the your fuel, but the engine oil for the long life, the hormone secretions. If the hormonal defect are there, it is a like a happy hormones are there, right? Serotonin and melatonin is secreting. So this, if it is not secreted, if it is less, it is secreted, it is end up with the disorder. That is what we are going to see in this introduction class. This is a small introduction. What you have understand today now is the man. Man is made up of a body, mind and spirit, and he has a constant interaction with the environment. With the environment he may develop a stressors, and the human mind is composed of brain, nervous system, sensation, hemispheres, area of the brain, cerebellum is called the mini brain. Understand, forebrain, midbrain, hindbrain, and you have to understand that the brain is developed before the mother knows that she is pregnant, 4th week. So the day of LMP to the next day of LMP only she knows pregnant. By the time the brain is started to develop, 9th day, 10th day, like that it started to develop. So during that time she exposure to that, she may get develop illnesses and also some genetical problems, exposure to the radiation or some pathological conditions or some of the drugs. These all may cause the mental illnesses. Okay, first we will come to what is called the mood. The mind. The mind, if you told you, I told you what is called preconscious mind, subconscious mind, conscious mind. The alteration in the consciousness will be the mental illness. So, what is alteration? How it will be? The alterations will be there. The clouding of consciousness. Don't know, very drowsy, like a drug addict will be like. The drowsiness will be there. Sometimes coma. You cannot revert back. You are coma. There is a scale. Glasgow coma scale will be a 0. And the dissociation, you do not know the fugue, the memory loss. Fugue is memory stupor. So qualitative changes in the consciousness, like confusion and delirium, short-term memory loss. If you continues, it may go to the dementia. So these all end up with the mood disorders. Understand? So then about the how the behavior is forming, body like thinking is affected, how the thinking will be affected, how this perception, the person is how he perceiving. So sensation, visual is one kind of a sensory sensation, or how he perception. If it is deviating from the, he may misinterpret like the snake as a rope, or rope as a snake. So this is a visual, like illusion, hallucination, tactile sensation. The excessive perception of this will lead to the psychiatric illnesses. Then also the motor. Once the sensation going to the area, then will be the reflex will be coming, motor reflex, right or not? So the motor is a movement. You can remember that. This one, a hypokinetic disorder, this a slow movement will be there. Hyperkamic disorder will be the excessive movement. Stereotypes, without any, this one very much stereotype, it will not effectively move or show your emotion. And then dystocia, tremors, these are all the motor defects. So okay, then will be perception, I told you already. The memory also, deviation from the memory, amnesia, loss of memory usually will come for the old age people, but suddenly this one will be in a hypermnesia, like they are not forgetting anything. Usually by to get to some of the things, you have to do hypnosis and take the memory, but they never forget that also. Paramnesia, the disturbance of the memory. So it's all the memory related disorders will be coming. So then if you see hormones, in the brain, I told you, endocrine system is very essential. They are like a engine oil. In our body, we have a happy hormone, serotonin, melatonin, euphorin. So these happy hormones are dopamine. So this increase in dopamine secretion, everything, even the good thing also you take more, that will become your poison in our body. So that's a dopamine is increase one, it will be they end up in the mania and schizophrenic disorder. If it is so much decrease, Parkinson's disorder, and histamine is decrease, you will go for the depression disorder. Decrease norepinephrine, again depression will be coming. Decrease serotonin will be the Alzheimer disease. GABA, that is the gamma amino butyric acid, if it is decreasing, you will get the anxiety disorders. So the normal human being, he is very conscious human being. He has a bodily system. If the bodily system have pathological condition, again he may get some disorders. So these disorders are broadly classified into psychotic disorder and neurotic disorder, that we will see in the next video. Next, another thing you have to see, other than psychotic neurotic disorders, the man is always though he is a body, mind and spirit, he has a constant interaction with the environment. So the environment is consists of everything: man, animal, physical environment with man, social environment, biological environment, and many stress may be coming. If you take million of years ago, the man is interacted with the environment. He had a great fight with the animals. He just overcome that, and bodily some hormones are secreted, right? Epinephrine will be secreted, and he learned to run very fast to save his life from the animals, right or not? So then after some time he used some defense mechanism to kill the animals. He used his stones and sharpen it and many things, and he overcome that stress from the animals. He started to survive in the earth. So his behavior is changing. So what is called behavior? Behavior, how it is developing for any human being, you are perceiving something. For example, if you see the child will be act like a mother. When she go to the school, she will act like a teacher. So directly or indirectly, we admire some persons. We also perceive something, and we perceive and take into our mind. That mind, we admire that, and it will be reflect in our behavior. The repeated behavior of an individual will become a personality. We might have studied different type A personality, type B personality, extra XSY personality. So but each personality people will be interact with the environment, protect themselves, they behave normally. The adjustment with the stressors, he will be adjusting with the stressors, he will be a normal and healthy individual. If there is a maladjustment with the stressors, that will be end up with the mental illness. So alteration in thinking, alteration in emotion, alteration in a behavior impaired, so may be developed the personality development disorder. What is called defense mechanism? Like a repression. Repression maybe involuntarily forgetting some of the birthday of the anybody, and denial something. Did you eat? Did you steal? No, I never. Displacement. For example, he had so much stress in his workplace, but he cannot show to his boss. He displays to his wife, and projection. Maybe he has something loss in his business. He will tell you, you are the unlucky wife. Because of that, I got it. Somebody's compensation. He is not very good in his studies, but he is very good. He put all this effort in the sports, so he will compensate to overcome the stressors. Reaction formation. Inside he may hate some of boss, but in front of him he will put namaste, nice ma'am, how are you ma'am, we are talking. That's a reaction formation. Hating inside but expressing outside is very good. Regression is like a temper tantrum, like bedwetting or thumb sucking or bedwetting. To overcome the stress, something they will be biting the nails. Even they are becoming big, also they will bite the nails to overcome the stress. Sometimes they will isolate. So if what will happen, this any of the isolation, long time isolation, what will happen? It will end up into the depression. Correct or not? So we are not gone into the topic. We have seen today's class what is called mental illness. How the man is made up of. How mental and illness. Any diseases affecting the mind is called the mental illness. So how the man is composed of man and body. Man is composed of, you can tell, body, mind and spirit. This man is composed with body, mind and spirit and always interacting with an environment. This is a holistic model I have taken to explain how the human being is. This body consists of maybe 10 subsystems are there, respiratory, integumentary, bone, many subsystems are there. Each systems are interrelated with each other. Also, this all controlled by the brain. Right or not? So this brain also, the body and mind, if a mind is affected, body is also affected, behavior is going to affect, so and body health also going to be affected. So mind is consists of what? Conscious mind, unconscious mind, preconscious mind, and the million of nerves are connected with your nerve tract. So this is called nerve, responsible for sensation and perception. Nerve once take the sensation and the reflection is the motor. So motor is also a track, as defending track, the impulses are coming. Any defect in that, excessive movement or low movement, slow movement, again is a defect. Then the low hemispheres are the right and left hemispheres. What are all the gray matter, white matter is there. And more or less they have an endocrine system. Like endocrine is a hormone. Hormones are called the chemical messengers. What is called chemical messengers? They will there is a small amount of the hormones are secreted, and master of the master gland is called the hypothalamus, and the master gland is called the pituitary. In the lymphatic system, they will be these hormones are the chemical messengers going and hitting the target cells to secrete the other hormone. It is like a engine oil to run your body properly. If this engine oil is excess also, the machine will have a problem. If the engine oil is less also, machine is going to be a problem. That's what the machine will work hyperactive, it's called mania. No active, low active, it's called the depression, schizophrenia. Various disorders may be coming. So you have to understand what is psychology, what is psychiatry, illness. Okay, so this is you hope you understand. So we are dividing the diseases like a psychotic illness and neurological disorders, that we will see in the next class. So this is my small introduction about the psychiatry. Thank you.